We're glad to see you. We're glad to welcome you here today to the beautiful Hickenbotham Outpatient Center for this important announcement. Having worked now for over 37 years here at Baptist Health, I've had the privilege on many different occasions to make major announcements on behalf of Baptist Health. And I'm not going to list those because it would take us a while, but from announcing the $110 million capital campaign for this campus, to acquiring and building several new medical centers, clinics, all across the state, and all for the purpose of improving health care for Arkansans. Today, we're announcing another significant new organization, along with a group of leading physicians. Baptist Health and a group of outstanding physicians from multiple specialties have been working hard because I've watched their work for now over 18 months to design this new organization. And the whole purpose of this new collective working agreement is to improve quality and safety for our patients and to help reduce costs for our patients. Today, the result of this hard work is culminating in this announcement, which we're pleased to make, announcing today the formation of Baptist Health Physician Partners. You know, what's really unique about this particular endeavor is it's strictly physician-led, physician-managed, physician-driven, and hospital-supported as we find a new way to deliver on our promise to take care of all Arkansans. Baptist Health Physician Partners is beginning today with more than 200 physician partners listed on this board over here. That's a great beginning. We're very pleased with that. You'll be hearing, in addition to all the members over there, the partners developed a board of managers, and the board of managers for this endeavor is chaired by Dr. Chris Cate, a surgeon on our staff, along with 11 other physicians. And you're going to be hearing from Dr. Cate in just a moment. But I want to introduce the physicians. Some of them are here, but I want to call their names, even for those who were unable to join us. Dr. Whit Napple, Dr. Carl Johnson, Dr. Dwight Chrisman, Dr. John DeLoach, Dr. Eddie Phillips, Dr. Herbert Hahn, Dr. Fred Nagel, Dr. Jim Hazelwood, Dr. Jerry Byram, Dr. Balin Nair, and Dr. Wendell Pauls. These are the physicians who make up the board of managers for Baptist Health Physician Partners. Let's give them a hand for the great work they've done. Baptist Health Physician Partners is, I think, the newest example of Baptist Health and our medical staff coming together to work to develop novel ways to further improve clinical quality for our patients, but also to work together to reduce the cost for our patients. We're all focused on and dedicated to that endeavor, and we have a group of physicians now who really are involved with us in trying to make that happen. I'm pleased with the work that they've done. I'm pleased with their commitment. I'm also pleased with the commitment of our own board of trustees to help make this happen here at Baptist Health. Now it's my privilege to call on Dr. Chris Cate, our leader and chairman, and he has some words to express to you today. Dr. Cate.
Thrilled to be here today and very, very excited to announce this partnership between Baptist Health and a large portion of the medical staff. We're beginning today with over 200 physician partners, and this number is going to grow, we think, very rapidly. We're enlisting physicians all across the system to participate and think we will have probably the majority of our staff to join at some point. We do want to emphasize this program is open to all physicians. This is not exclusive. This does not preclude you from participating in any other project or plan, and that it is open for anyone who's interested, and that at this point we're actually actively recruiting physicians and starting to meet with various leadership personnel and various practices around town. One of the things that participation in this is going to require is a commitment to quality, because this program really is about quality and it's about improving patient care. the physicians that join this network will have to improve on the care that they deliver to their patients, and that's going to be one of the requirements of this program. On my graph here to the right, and a little hard to see, kind of small print, but basically you have clinical integration programs in other parts of the country where physicians have participated or not participated. And there's dramatic differences in physicians and the results when they participate. Now, a large part of this is simply data gathering. One of the things that as physicians we found is that we do self-correct. We just have to have the information. We have to know that we're at the 70th percentile of some type of parameter or measure in order to get to the 80th, 90th, or 100th percentile. And so that's the biggest part of this program. Is going to be sharing with physicians their quality data and having them self-driven to improve. One of the things that will come out of this quality program and improvement in patient care, we hope, is negotiations and discussions with third-party payers. We think that third-party payers will find that this is not only better care for their patients, but more cost-effective care for their patients. We're very excited about that. We anticipate that this will help us develop more collaboration between the medical staff and the hospital. This is not something that's ever been undertaken in this part of the country before, but it's been done in several other regions around the country to great success. I'd really like to thank all the physicians on the team that have worked hard. We've worked for over 18 months now and invested a great deal of time and energy. But I'd also like to really express my appreciation to Mr. Harrington, the Board of Trustees of Baptist Health, and the administration of Baptist Health for all their support that they've given us. Thank you.
And one of the reasons I know this is going to succeed is because the physicians have developed their standards of care. And there's been no hesitancy on their part to do this. So they will be measuring themselves against the standards that they established. And so that's what gives me assurance that it's going to work. I hope today will be a day that you'll remember for a long time, not because it was sleeting when we had the news conference, but because it really marks an important day in our history as we come together, the physicians and the system, to work even more collaboratively than we have in the past. You know, we face a number of challenges today in healthcare, and it seems like the challenges are getting more immense as the days go by. And you don't have to be a member of healthcare to know this. All you have to do is read the paper. We believe that working together is the only way that we can both survive and be able to overcome the challenges that are presented us. And so I have great appreciation for the members of our medical staff who've worked diligently now for 18 months, and they understand this is just the beginning. There's still a lot of hard work ahead of us, but again, I'm assured in my mind that we're going to be successful because of the quality of the medical staff who've made a commitment to this endeavor to work together for the benefit of our patients. So let me thank you on this cool day for coming out and being a part of this gathering. It is an important one, it is exciting, and we look forward to continuation of this work as we move into the future. Thanks again for coming.